Welcome to the Surgical Edge podcast for surgical insights, reviews, discussions, and to stay updated. Let's dive in.
Welcome to the Deep Dive. We're your shortcut to getting well-informed, taking key sources, and pulling out the absolute must-know insights for you. Today, we are tackling something really significant, that huge leap into being an FY1 doctor in the NHS. And we're zooming in on, well, what often feels like the toughest part, the surgical rotation. Our main source today, a surgical posting survival guide, calls it fast-paced, physically demanding and requiring quick decision-making. Which, let's be real, sounds pretty daunting for anyone starting out. It's a shared challenge, right? So our mission is really clear. We want to pull out the core wisdom from this guide, give you some concrete strategies. The aim isn't just getting through it, surviving. It's about actually thriving, making it a rewarding experience, not just a tough one.
Exactly. And this isn't just, a checklist. It's more a framework for how to actually apply this stuff, understanding the why behind it all. That can really change how you approach things. It gives you actionable knowledge you can use straight away, turns that potential overwhelm into actual confidence.
Okay, so let's dive in. You walk onto that ward, first day, it's hectic. Where do you even start? The guide says the very first thing is knowing who's who.
Yeah, that's spot on. The sheer number of faces, the different roles, it can be really disorienting. So understanding the surgical team structure, absolutely crucial, the guide says. Not just names, but what they actually do. So at the top, you've got the consultants. They're the lead decision makers. You probably won't interact with them constantly day to day, but showing you're diligent, that definitely makes a good impression.
Right. So impress them from afar. Initially, at least.
Kind of, yeah. Then your main senior contacts day-to-day will often be the registrars. That's usually ST3 level and up. They're the ones you'll run more complex clinical decisions past. They hold the sort of bigger picture view.
Okay, so registrars for the bigger stuff.
Exactly. And then just below them, you have the SHO's senior house officers, core trainees, CT1 or 2. Think of them as your immediate seniors. Really good for asking about daily tasks, ward jobs, that sort of thing. Your first port of call, often.
Makes sense. Your go-to people.
Definitely. And then absolutely essential, you cannot function without them, are the nurses and the allied health professionals, the AHPs, physios, OTs, dietitians. The list goes on. The guide really stresses building good relationships here. They see the patients constantly. Their insights, invaluable.
Okay, so there's a clear tip embedded there. Figure out who to approach for different issues, like SHO for prescribing help, registrar for a complex patient problem.
Precisely. It streamlines everything.
Yeah, I can see that.
Yeah.
Knowing who to ask for what saves time, gets the patient sorted faster, and honestly probably makes your life a whole lot easier. It's like having a mental map of how communication should flow. But, okay, even before day one, there's stuff you can do, right? The guide really bangs the drum about getting a head start, refreshing knowledge beforehand.
Oh, absolutely. It calls it getting a head start. Think of it like preloading your brain to reduce that initial shock. The guide strongly advises reviewing a few key areas. First, common surgical conditions, your appendicitis, cholecystitis, bowel obstructions, stuff you'll see constantly.
The bread and butter.
Exactly. Second, post-op care. Wound management, checking drains, fluid balance. That's going to be a huge part of your job.
Right.
Third, emergency presentations. Sepsis, bleeding, the acute abdomen. Knowing the initial steps when you get that bleep.
Crucial.
And finally, key guidelines. Definitely NICE guidelines, National Institute for Health and Care Excellence, and any local trust protocols. They might have specific ways of doing things.
And are there specific resources it points to for quick lookups?
Yeah, it mentions things like the Oxford Handbook of Clinical Surgery or Surgical Recall. Not for reading cover to cover, but great for quick checks on the ward. Pocket guides.
You can see how doing that homework builds confidence. Instead of feeling totally lost trying to remember basic stuff, you got a foundation. It frees up brain space for the new challenges.
Okay, precisely. Less cognitive load right at the start.
So you've prepped, you sort of know the team structure, but then you're on the ward and it's just relentless. How do you actually manage the sheer volume of work?
Time management is key, the guide says. It really, really is. Surgical wards are fast. The guide breaks efficiency down into practical steps. First, prioritize.
Obvious. Maybe. Sick patients first.
Well, yes, but it's more nuanced. It's about spotting the subtly sick patient, the one who isn't necessarily shouting the loudest. That takes vigilance. Then, yes, routine jobs like TTOs, discharge letters.
Okay, so vigilance and priority. What else?
Use a checklist. Not because you're simple, but because it ensures consistency. Bloods, imaging requests, referrals, documentation. You don't want to miss things when you're juggling.
Right, a safety net.
Exactly. And then there's pre-rounding, reviewing your patients before the main ward round, check results, see how they are overnight.
So you can anticipate jobs in question.
Precisely. You're ready for the consultant. And importantly, delegate appropriately. Nurses are highly skilled. They can often help with things like catheters or bloods if needed, freeing you up.
It requires good communication and relationships, though.
Absolutely, it all links together. And a really practical tip the guide gives: keep a written jobs list and keep updating it through the day.
So things don't fall through the cracks when you get interrupted by bleeps.
Exactly. You tick things off, add new ones. It avoids that awful feeling at handover where you realize you forgot something important.
So what this means for you, the FY1 listening, is turning that potential chaos into something manageable. You're taking control of the workflow, not just reacting. Makes it feel less overwhelming, right?
Definitely. It's about imposing structure on the chaos.
Okay, moving from tasks to paperwork, documentation. It sounds administrative, maybe even boring, but the guide stresses its importance. Why is it so critical, beyond just record keeping?
It's huge. Yes, patient safety, medical legal reasons, those are massive. But good notes are also about communication and efficiency. Well, where FY1s sometimes struggle is writing notes that are either too brief and miss key info or too long and rambling. The guide really pushes the SOAP format. Subjective what the patient says. Objective your findings, OBS, labs. Assessment your diagnosis or summary. And plan what you're going to do.
Structured thinking, reflected on paper.
Exactly. It makes it easy for anyone else reading the notes to quickly understand the situation. And beyond format, document key decisions. Consultant reviews, chats with relatives, why you changed antibiotics. It creates a clear trail.
Defensible record.
Yes, and handover needs to be crystal clear. Make sure the next team knows exactly what's pending. The guide also mentions using electronic systems like EPIC or Cerner effectively, knowing the shortcuts, getting proficient that avoids delays.
Yeah, wrestling with the IT system can be a huge time sink if you're not familiar.
Totally. Imagine trying to explain a complex patient to the night SHO without clear, concise notes. It's asking for trouble.
I get that. Good documentation actually reduces your own stress. Knowing it's all recorded properly is, well, reassuring.
Yeah.
And it helps the patient by ensuring smooth continuity of care.
Absolutely vital, especially when teams change so often.
Okay, so we've covered teams, prep, organization, notes. But surgery is hands-on. What about the practical skills? What does an FY1 really need to get comfortable with quickly?
Right. This is where you start to feel like you're properly doing the job. The guide lists the essentials. First, venipuncture and cannulation. Taking bloods, putting lines in.
Daily tasks.
Pretty much the advice. Start with the easier veins to build confidence. Don't aim for the impossible challenge on day one.
Sensible. What else?
Catheterization. Key thing here. Yeah. Male and female techniques are different. Ask for supervision the first few times. Definitely. You don't want to cause trauma.
Okay. Supervision is key.
Always. Then NG tube insertion, nasogastric tubes. The absolute must-know here is confirming placement, pH testing of aspirate or chest x-ray. You cannot risk it going into the lungs.
Serious risk. Got it.
And finally, basic wound care. Simple suturing, managing surgical drains. The overarching tip for all of these, the guide repeats. Ask an SHO or registrar to supervise you until you feel confident.
Don't be shy about asking.
Never. It's not weakness, it's responsible. Patient safety first. You're learning.
That's such an important message. It's a steep learning curve, and asking for help is actually a sign of strength and professionalism, isn't it?
Yeah.
Shows you prioritize safety.
100%.
Let's shift now to something that underpins everything. Communication. The guide is clear. Good communication prevents errors, improves care. It's not a soft skill. It's a core clinical competency. How do you do it well under pressure, especially with different people?
Yeah, it's critical. The source gives specific examples. With seniors, be concise. Get to the point. Like, the 60-year-old man with pancreatitis has a rising CRP and more pain. Should we escalate his antibiotics? Clear situation, assessment, question.
No often.
Exactly. With nurses, be polite, be clear. Example, can we please give this IV paracetamol at 2 p.m.? Direct, respectful, actionable.
Simple.
And with patients, simple language.
Yeah.
Avoid jargon, like, we need to put a small tube down just to help drain your stomach. Explain what and why, simply.
Makes sense. And the guide mentions a specific tool, SBAR.
Yes, SBAR, Situation, Background, Assessment, Recommendation. It's a structured way to communicate, especially for handovers or escalating concerns.
How does that help specifically?
It forces you to organize your thoughts, present the crucial information logically and quickly, cuts through the noise in busy settings, reduces the chance of missing something vital. It's really valuable for safety.
Right, so it imposes clarity, designed for those high-stakes moments. I can see the value. Okay, let's talk on-calls. The guide acknowledges they're stressful, especially for FY1s. How do you prepare? It's not just about turning up, is it?
Definitely not. Preparation is everything for on-calls. The guide suggests, first, know the common bleeps.
What are you likely to get called about?
Exactly. Pain, nausea, vomiting, low urine output, bleeding, maybe a post-op fever, a patient looking unwell. Knowing these helps you mentally prepare your initial approach.
Okay, anticipate the common calls.
Second, when you are called to an unwell patient, always assess systematically. Use the A to E approach. Airway, breathing, circulation, disability, exposure. It's a structure that stops you missing critical things under pressure.
The safety framework.
Precisely. And maybe the most critical point, know when to escalate. The guide is blunt. If unsure, call your SHO or registrar early.
Don't wait until things are really bad.
Absolutely not. It's always better to call early. Seniors prefer it. They want to know sooner rather than later if there's a problem brewing.
Okay. And any tools for on-call?
Yeah, the source suggests carrying a pocket guide, like the Resident's Guide to Surgery, just for quick reminders or checking doses when your brain feels fried at 3 a.m.
That makes sense. That preparation, knowing common calls, having the AE structure, knowing when to call for help, it must make you feel more in control during those intense moments, building a mental toolkit.
Exactly. Reduces the panic factor.
Now, the guide mentions surgical rotations are exhausting. This leads us to managing yourself, not just the patients, avoiding burnout. It can feel like a side issue for a busy FY1, but why is it so essential?
It's absolutely not a side issue. If you're burnt out, your judgment suffers, you make more errors, your empathy tanks. Self-care isn't selfish, it's crucial for safe practice.
So what strategies does the guide suggest?
Several practical things. Take breaks. Even 5 minutes away from the ward to just breathe can make a difference.
Just step away.
Yeah. Debrief after tough cases.
Yeah.
Talk to colleagues. Don't bottle up difficult experiences. Maintain work-life balance. Have interests outside medicine, exercise, sleep, see friends. Don't let the job consume you entirely.
Easier said than done sometimes, though.
True, but vital to strive for. And use support systems. Your mess, FY1 teaching groups, your educational supervisor, or professional counseling if you're really struggling. Don't suffer in silence.
Any quick tips for in-the-moment stress?
The guide mentions mindfulness or simple breathing exercises. Just taking a few deep, slow breaths before answering a stressful bleep can help center you. Quick, discreet, effective.
That really drives home that looking after yourself isn't optional. It's fundamental to being a competent, safe doctor. You need to be okay to look after others properly.
Couldn't agree more. It's foundational.
Okay, we've talked a lot about coping and managing, but the guide also encourages FY1s to actively seek learning, to maximize the rotation. How can you realistically do that when you're so busy?
Great question. It's about being proactive, even in small ways. The source suggests several things. Attending theater is a big one.
Seeing the surgery itself.
Exactly. And ask if you can assist, even just holding instruments or doing some simple suturing under supervision. That hands-on learning is gold.
What else?
Try to join clinics sometimes. See the outpatient side, the before and after. Ask for feedback regularly. Don't just wait for formal assessments. Ask seniors, how did I do with that handover? Or any tips for my cannulation technique?
Actively seeking improvement.
Yes. And get involved in audits or quality improvement projects, QIPs. The guide highlights these are great for your portfolio and show initiative.
Looks good for future applications, too.
Definitely. And if there are departmental teaching sessions or journal clubs, try to go. Show you're interested in learning beyond the immediate ward tasks.
So it's about grabbing those opportunities.
Yeah.
It shifts the mindset from just getting through it to actively growing as a doctor during the rotation.
Precisely. Turning challenges into learning moments.
And that brings us to the final, perhaps most crucial point the guide makes. Knowing when to ask for help. There can be this fear, can't there? Looking incompetent. How does the guide tackle that?
It tackles it head on. The core message is crystal clear. It's better to ask early than make a mistake. Patient safety trumps ego every single time.
So when should you absolutely ask?
The guide gives clear scenarios. Unstable patient, someone deteriorating rapidly. Call for help immediately. No hesitation. That's usually crashing the bleep or putting out a senior call.
Right. Emergency.
If you're uncertain about management, a tricky decision, not sure of the right path, discuss it with your SHO or registrar. Don't guess.
Okay. Uncertainty equals discussion.
And if you're feeling overwhelmed by the workload, a difficult case, personal stress, talk to your educational supervisor, a trusted senior, or even occupational health. Don't just struggle alone.
Seeking support for yourself, too.
Yes. And the really reassuring bit, the guide explicitly says, no question is stupid. Everyone was an FY1 once. Everyone understands it's a learning process.
That's so important to hear. It normalizes asking questions, frames it as part of the learning culture, part of being safe. It acknowledges the support system that should be there.
Exactly. It's about fostering that safety culture.
So wrapping this deep dive up, the FY1 surgical rotation, it's tough, no doubt. Fast-paced, demanding, but also incredibly rewarding. We've covered understanding the team, prepping beforehand, getting organized, nailing documentation, learning practical skills, communicating effectively, handling on-calls, looking after yourself, seeking learning, and that crucial step, asking for help when you need it.
And if you take these strategies, these ideas, and really try to integrate them, you won't just cope. You'll likely excel. You'll grow into a much more confident clinician by the end of it. And remember, seriously, every doctor has walked this path. Everyone's been the new FY1 feeling overwhelmed.
Yeah.
So use the support around you. Keep learning. Keep asking questions. You will grow.
Absolutely. And maybe a final thought for you to take away. Think about how these principles, preparation, team awareness, clear communication, self-care, asking for help, aren't just for surgery. These are fundamental skills for your entire medical career, whatever path you choose. How can you apply these lessons every rotation, every demanding clinical situation you'll face? Something to mull over. Thank you for joining us on this deep dive.
Thank you for listening to the Surgical Edge podcast. Don't forget to like, share, and subscribe. Help us grow and deliver even more relevant surgical content by pressing the support button. Your contribution truly makes a difference. And don't forget to share with us your advice, feedback, and the topics you would like us to include.